Good evening. Thank you for joining us. I'm Keith Garvin.
And I'm Christine Noel. Chris and Dominique are off this evening. The governor of New York, Andrew Cuomo, says at least 2 airlines, British Airways and Delta, have agreed to require pre-departure COVID tests of UK passengers before they fly to New York.
That new strain of the coronavirus is believed to have originated in London or southeast England sometime around September. More countries are temporarily grounding all flights and inbound transportation from the UK. The U.S. is not currently one of those.
What has health officials in the UK so concerned is that this variant strain of the virus is said to be up to 70% more contagious than what's currently going around in our communities.
And in times like these, when news is developing by the minute, misinformation can easily spread online.
Our Robert Arnold is putting one social media post through our trust index tonight. And Robert, what have you uncovered?
Just because a virus mutates to the point that it becomes more easily transmitted does not automatically equate to that virus becoming more lethal or even more severe. Yet that hasn't stopped claims like that one from pinging around social media. In bold letters, this tweet warned followers a new COVID-19 strain in the UK is more likely to be fatal or cause serious illness. Houston Health Authority Dr. David Pearce addressed this mutation today.
It does not appear to be any more lethal. It doesn't cause any more serious illness.
We also spoke with Dr. Pedro Piedra at Baylor College of Medicine. He and his colleagues have been studying COVID-19, mapping the virus and cataloging mutations.
Is this variant more deadly or even more severe than the COVID-19 strains we've seen prior?
No, I don't think we can say that at this time.
So KPRC's Trust Index is marking that tweet as not true. Piedra also says this mutation is not unexpected.
So every change that it makes becomes concerning because it's like an unknown. But the reality is this is what these viruses do.
Piedra's colleague, Dr. Visanti Averhanula, also shoots down talk the new strain will thwart our new vaccine. She says it takes years for viruses to mutate to the point vaccines have to be reformulated.
That misinformation definitely has to be challenged and been removed from the public so that people are not afraid that it's not going to work anymore.
Now, at the beginning of this report, you heard that UK officials are saying that this new strain is 70% more transmissible than prior strains. We spoke with the doctors here at Baylor College of Medicine about that as well, and they say while that number is certainly possible, it is based this time on predictive modeling and has not yet been confirmed through lab testing. Reporting live from Baylor College of Medicine in the Texas Medical Center, Robert Arnold, KPRC, Channel 2 News.